For some people, life with dental pain is just life. It's normal. They are forced to learn to eat, work, socialize, and go through daily life accompanied by pain that prevents them from succeeding. Luckily, there is hope for those who face barriers to oral health care. Thanks to the donations and sponsorships of many, these dental and community volunteer heroes are restoring smiles and hope. Want to change a life? It starts with you.
The importance of a smile in our society is huge. When your smile is affected, it can affect the way you feel about yourself. It affects the way you are perceived by other people. So at CDA Cares, what we do is we try to give smiles back to people. We work very hard to ensure that every person in this state has the ability to have a great smile.
I was in so much pain, it affected the foods that I could eat, so I kind of stopped eating apples, and then it slowly progressed something as soft as a hamburger bun. Work, I'm getting headaches.
I was missing roughly 5 from the top and 6 at the bottom. When you're missing your teeth, you don't want to smile at all, you feel embarrassed. I work at home now.
I do cabinets for a living, and I get interviews and I come in and they don't see teeth and they're like, okay, now he looks crazy. It does affect the client's overall perspective of what they think and who they're allowing in their home.
At CDA Cares, we have over 100 treatment chairs, whether it be in triage, in x-ray, in the lab, restorative, dental hygiene, lots of opportunities to treat patients, and many, many chairs that are staffed by the volunteers that are here. I'm one of about 1,500 volunteers taking care of the needs of the public. Among that 1,500, there's about 800 dental professionals, between dentists, hygienists, dental assistants, and people from our offices and the community. The balance of the volunteers are community volunteers, and these volunteers help by guiding patients, helping in setup, helping in translating for those patients that maybe English is a second language, and generally assisting in anything they can do. They are a great, great help, and we're thankful for all that they bring.
Here in California, we have over 5 million people who really have no dental care at all, and a lot of them end up showing up at our CDA Cares events throughout the state. Yeah, I think the access to care, the biggest barriers is probably the cost alone. A lot of the patients that we're able to see here actually work Monday through Friday. The seniors, along with them, they have an access to care and an income problem there too, so we see a lot of those types of patients. I think language can be a barrier too to care, as well as transportation.
At CDA Cares, we do a lot of cleanings, fillings, and extractions for patients. Unfortunately, we do see a lot of decay that's beyond our ability to do fillings, and we do end up doing a lot of extractions. We are, however, able to also do some limited partial dentures, full dentures, and some root canals for front teeth.
We see a lot of pain and infection here at CDA Cares, and the hardest part is knowing that all of that could have been prevented with good preventive oral health care. At each one of these CDA Cares, we do about 2,000 dental extractions because the teeth just can't be saved, and that's what's really the heartbreaking part. We really want to not only fix people, help them, help their self-esteem, but we want to really engrave the importance of good oral health care.
For decades, the DentaCal program in the state of California has been severely underfunded. We as dentists knew that. We've been fighting for increases for funding from the legislature. We continually also look for ways to improve access to care, and CDA Cares came along and shines the spotlight on that need. One of the wonderful things that happened secondhand to that was the fact that as legislators would come through and see this need for access to care and see how we as a profession were trying to improve that access to care, they saw the need to better fund DentaCal. This has been a wonderful thing in addition to what we do here in this program.
So when the patients come in, the first thing they do is they get educated on how to take care of their teeth, how to keep their teeth healthy. Because in prevention, if you spend $1 in prevention, you're going to probably save $50 or more in having to do emergency treatment on someone. So teaching people how to just take care of their smile is a big part of what CDA Foundation does.
It's great to have my smile back again. Thank you.
Feeling great, confident, and ready to work. Yeah!
Want to change a life? It starts with you.